So when we're using mobilisation techniques to the thoracic spine, the traditional approach is to use specific points for the spinous process or the facet joint. But in actual fact, these low-grade movements have been shown to be unlikely to cause a substantial movement. So nowadays we tend to use more gross movements. And for the thoracic spine, what we're going to do is to use an extension movement which will affect the costovertebral joints, the costotransverse joints, and the spinal segment itself. So I'm taking one hand and placing it along the length of the spine with the fingers pointing down towards the hips. The other hand comes with the fingers pointing towards the shoulder. So I'm leaving that little gap for the spinous processes. And the action to start with is a low-grade mobilisation, so my elbows are bent and I'm softening that movement by just gently pressing in. As I want a higher standard movement, I can straighten my arms and lean the whole of my body. And normally I would adjust the couch so that I've got a lower couch. And my point of application is the thenar eminence on one hand and the pisiform on the other hand. So I've just broadened out a little bit from the traditional contact point, which would be of the thumbs. So that action is certainly suitable for somebody who is young or somebody who's flexible. Obviously there would be cautions if somebody is slightly older or if they have osteoporosis. So we're trying to encourage rather than force that thoracic movement.